What I'm about to say could get me in a lot of trouble, but I think it's important enough to say. I'm a labor and delivery nurse, and I treat my Black patients differently. I've seen nurses, especially labor and delivery nurses, online saying things like, "I'm colorblind, I don't treat my patients any differently," meaning that they don't treat their Black patients worse than they treat their white patients. And here's why it's not enough to be a colorblind nurse in 2023. Because I know that in my specialty, labor and delivery, Black women are more likely than any other race to be harmed in pregnancy, childbirth, and beyond. The US is the worst place to have a baby if you're Black in the developed world. Why is this not happening anywhere else? Systemic racism. If you don't believe me, just Google James Marion Sims. So not only are Black women not believed about their pain, not believed about their symptoms, but also they may put off getting something checked out because they don't trust medical providers for good reason. So here's how I treat my Black patients differently. Number one, I don't expect them to inherently trust me because I'm wearing scrubs and a badge, and I don't get offended if they don't. Many Black women are coming in to have a baby already having experiences of not being listened to. And until I'm able to prove to them that I'm someone that can be trusted, they shouldn't trust me. More than my white patients, I emphasize the fact that I will always believe them. Yes, my white patients know also that I will believe them, but I really, really drive it home that I promise you that I'm going to believe everything that you say. I include every single person in the room who is supporting this patient in a conversation about preeclampsia, even if they don't have it. Because preeclampsia is one of the leading causes of maternal mortality in the United States. And preeclampsia can happen even after you've had your baby. I tell them about the symptoms, and I also tell the support people that if you hear her saying any of these things, make sure that she gets seen. And if when she gets seen, you don't feel like she's being listened to, go somewhere else. I let them know that I'm here to be their birth bouncer, and that I'm not going to let anyone do anything to them, only for them and their baby with their permission. I can neither confirm nor deny whether I have slapped a provider's hand away when the patient said no. I don't know anything about that. I have no hard data to back this up, but I have a hypothesis that Black women are not being repositioned in labor as much as white women. So my patients know, and I will say this, that I'm going to turn you like a rotisserie chicken because movement is gold in labor, especially after you have an epidural. If when we have a baby, I don't like the amount of bleeding that I'm seeing, I am early talking to that provider about, hey, what do you think about maybe giving a little bit of Cytotec? What do you think about putting in a Jada? Because postpartum hemorrhage is the leading cause of maternal death. I will always use whatever privilege I have to make sure that my patients are heard. That's why it's so important to treat your Black patients differently. And if you're a colorblind nurse, you're part of the problem.
I'm sorry, as a Black woman, we cannot sit here and complain about how poorly we are treated in the healthcare setting, which most often entails being ignored, not having our concerns taken seriously, and bad things happening to us, typically because we are ignored and not paid attention to and not treated the same way as white women. And then on the flip side, come over here and assault nurses who are trying to actually take care of us. And honestly, this is where it becomes a difficult situation for me because I'm not just going to support somebody just because they're Black. What is wrong is wrong. What is right is right. I absolutely acknowledge that she's been through some trauma. She lost a baby. But in that video, she also talks about how she was ignored. She was neglected for hours, almost bled to death for hours. And a lot of what happens to Black women comes because we're not treated equally, not given the same treatment plans, not given the same options, ignored repeatedly. And then here you have a situation where you have a nurse who needs to take care of not just the mother, but also the baby. The nurse is caught between a rock and a hard place. If this was a patient who was a sole patient who didn't want to be touched, fine, document and move on. But the nurse is also taking care of a baby. If something were to happen with that baby, what do you think she's going to say? Well, they didn't check on my baby like they were supposed to. They should have checked on my baby like they were supposed to. We can't come to the hospital and bully healthcare workers into not doing their jobs. I'm sorry. We can't. That's one of my very first videos to really, when I first got on this app, was about the OB department and IVs and people coming to the hospital and refusing IVs because, well, I don't want it, blah, blah, blah. We have to realize that there are certain things that we need to do as healthcare workers to keep our patients safe. And if those patients don't want us to do those things to keep them safe and their baby safe, then we don't need to be putting ourselves in harm's way with our licenses and with our physical being trying to take care of those patients. I mean, why do y'all? I'm sorry. You can acknowledge somebody's trauma, but you can also acknowledge that they did wrong. And in this situation, they did wrong by assaulting a nurse. That's it.
So, good morning, Black people. Good morning, Africans. Today, I want to ask you something. Do you remember the hospital you were born at? We have two kinds of children. Children who are born at the hospital and children who are not born at the hospital. Who are not born at the hospital may include cars, homes, bushes, water, anywhere outside the hospital. It turns out that the children who were born outside the hospital had a good chance of survival compared to children who were born at the hospital if the children were black or if their parents were black.
This one wasn't so dope. It was about the time that I gave birth to my firstborn son, and I went through an experience where I was not believed, not listened to, and not given any bodily autonomy during labor. And I think it was a little bit traumatic. Well, y'all tell me. So I was a first-time mother, 21 years old, never given birth, never been to anybody's birth, never saw anybody through pregnancy. This is my first time experiencing pregnancy firsthand. So about 10 days before my due date, middle of the night, I wake up with like excruciating pain in my abdomen. I was living with my mother at the time, so I go to her and I'm like, hey, something ain't right. I'm hurting. I'm in pain. She immediately is like, that's contractions. Let's start timing it. We time them. They're about 5 minutes apart. At the time, I lived about 20 minutes away from the hospital that I was supposed to be delivering at. So I call the nurse and I tell them, hey, I'm having contractions. They're 5 minutes apart. What do I need to do? They tell me, come on in. Now, mind you, I have a pretty high threshold for pain, which is not a good thing to have if you're a black woman. And it's something that probably occurs because of people not believing your pain historically. And so you learn to just kind of eat your pain, swallow it, take the L. So I'm someone who had really bad menstrual cramps growing up. And so these were feeling like really bad cramps to me. I'm waiting for it to get worse, right? Which raises a good point about pain scales. You know, what's a 10 to someone else may not be a 10 to you based on your past experiences, right? If you've experienced pain that was worse than this, you might not register your pain as a 10 on the pain scale. So I get to the hospital, my mom drops me off at the emergency room door and she goes to park the car. As I'm walking in, I have to like stop at the doors because I am in such pain I can't walk. Now, the woman at the intake counter sees me doing this. She sees that I'm visibly pregnant. However, I am 5'11", I'm pretty tall, so I wasn't as big as you might expect a 9-month pregnant woman to be. So I get to the counter, I tell her I'm 9 months pregnant and I feel like I'm in labor. She sips her soda, puts it down. She looks at me and she says, I need your ID and your insurance card. I'm shuffling through shit. I find it. I give it to her. I'm like, hey, is there any way that I can just go ahead and go? Wait, we have to get you checked in and I have to print your bracelet out before we can do anything. Just calm down. I calm down. She takes her time. She's asking me all these questions. I'm like, hey, I'm in really bad pain. Like, I think I need to go. Like, I need to go now. I don't have time for this. There's nothing we can do until we get you this bracelet. So you're going to have to work with me if you really want to be seen. I'm 9 months pregnant. So they send the smallest woman in the hospital to come get my big ass. I was over 200 pounds at this point, and she's pushing me to the labor and delivery section of the hospital, which happens to be uphill for some reason inside the hospital. She's telling me the whole time, well, you don't look like you're in too much pain, so we're probably just going to send you back home, but we'll send you up here and check you just in case. She gets me to the room, checks me, and I am 10 centimeters dilated. She's like, everybody hurry, get the beds ready. So after all the nurses didn't believe that I was actually in labor and actually about to give birth, they discovered that I was 10 centimeters dilated. The only problem was there was no doctor in the building. It was the middle of the night and the on-call doctor lived like further away from the hospital than I did. So I'm laying in the bed, I'm feeling these pains, I'm feeling like I need to shit. And if you've ever had a baby, you know that when you feel like you need to shit during labor, it's because you finna shit out a baby. So again, this nurse who normally works the ER and is her first night in the labor and delivery ward, she's sitting at my bedside and I'm telling her, I feel the urge to push. One of y'all need to get down there and get ready to catch. She's like, no, you can't push right now. The doctor isn't here. I'm like, I understand that, but I'm about to start pushing. Mind you, I'm calm as fuck trying to talk to this woman because I already understand that my pain is frustrating them. She says, no, you can't push. Here, I'll help you. She shoves her hand inside my vagina and attempts to hold the baby in so that I can't push him out. I snatched this woman's hand out of my vagina and I'm like, no, you can't do that. I didn't give you permission to do that. And actually, it's not helping. Y'all, she just shoved her hand in my vagina. Didn't say a word, just, I'm gonna help you. And I'm like, no, bitch, no. Finally, the doctor rushes in. He's like slapping on his gloves and he just gets at the end of the table getting ready to catch. So as I'm pushing this baby out, mind you, the baby came so quickly that I did not have time to get any medication. Not a Tylenol, not a Motrin, definitely not no epidural, nothing. So while my child is crowning, I can feel everything. And if you've had a baby, you know that the crowning is the worst part. So I start screaming at the top of my lungs. I have no medication. I'm screaming at the top of my lungs. Another nurse runs to my bedside and she says, we need you to stop all that screaming. You need to calm down. For the sake of you and your child, we need you to calm down. I look her dead in her eye and I'm like, bitch, what the fuck? Calm down. You do it. So thank God I go ahead and push my baby out. He's perfectly healthy. I'm perfectly healthy. They finally get me to the room where I'm supposed to recover. A few hours later, the same nurse who normally works the ER and was in labor and delivery for the first time that night, she comes in with like 2 other nurses by her side. And she's like, I just needed to come show them the rock star that gave birth last night with no medication. I just wanted them to see you and just come in and show you to them. Like I'm a fucking circus attraction or something. I tell the other nurse who was in the room, I was like, I need you to tell that woman I don't want to see her anymore. Tell her don't come back to my room for any reason. I got beef with her. It's smoke. I had a few family and friends come over and visit. After they leave, the nurse comes back. She comes back to tell me that she didn't mean to offend me. She just wanted to show me off because she was so proud of me. Other than having a healthy baby at the end of that story, the best thing about it was the hospital I delivered in would give you a steak dinner when you got through. That was it.
Okay, so I don't know if anybody else has experienced this. I am a registered nurse. I've been a nurse now close to 15 years. And, you know, the racial disparity in this country never ceases to amaze me. You would think that after all of this time that we will be past that, but clearly we're not. I can remember when I applied at my local community college to get into the nursing program. I actually had an advisor to try to talk me out of going into nursing. She pretty much said, you know, hey, why don't you be a medical assistant? And I was like, no, that's not what I want to be. I want to be a nurse. And, you know, and this isn't to throw shade to any other races, but we all know it's no secret that African Americans, especially African American women have to work twice as hard, 3 times, 4 times, 5 times as hard to prove ourselves in this world, in society. And, you know, I've even been in workplaces to find out that, you know, I could have been there 2-3 years and they can have a new grad, you know, who's white, a white female, Caucasian, will come in and they will offer her $2, $3, $4 more than what I'm making even after being there. Or we could go at the same time and they will offer my white counterpart or my white colleague, we got the same amount of experience. Sometimes, you know, we may have more experience and they'll offer them more money. And so when I brought it up to the hiring manager at one of the hospitals that I applied to, this was some years ago, and I'm sure nothing has changed, but I asked her about it, and then she asked Human Resources, and Human Resources response was, well, that's what the system gives us once we put your information in. And I'm like, okay, so the only difference between my information and her information is our race. Now, we already know that there is a huge pay gap between men and women. We already know that men oftentimes get paid more, especially our white men. But, you know, I personally, you know, have experienced this, and a lot of my African American colleagues have experienced the same thing, my African American female colleagues, where we are offered a whole lot less and we can go in with more experience. And human resources' only rebuttal is, well, this is what the system gave us. Okay, so you mean to tell me that the system is broken? The system doesn't work? Because the only thing different that you're putting in is our race. The credentials are the same. A lot of times the years of experience are the same, or they may have less years of experience. So that's something to think about. Like, y'all let me know, has anyone else encountered this? Because I know I'm not the only one, because I have close friends and colleagues, especially in nursing, that have experienced this.
To the white woman next door, she's different to the Asian woman next door. You can't treat us the same. Hi, my name is Mama Dinya. I'm a nurse and midwife. I create content for women, specifically black women, so that they don't go into pregnancy clueless. Black representation matters in healthcare because it's life-saving. I've seen a lot of black women failed, and because of their lack of education, they don't even know that they've been failed. One of my biggest issues as a black midwife is trying to find a balance of educating black women without scaring them. I don't want black women to enter the hospital and be looking left and right. Who's trying to hurt me? Who's trying to do this? When they're meant to be enjoying their pregnancies. There was a black woman who delivered, and it was written in her notes that she refused her medication. So the student midwife, escalated to the manager in charge. She said, oh, don't worry, like, black people don't use medicine. When a black midwife overheard her, she went to the room and she asked the woman, why are you refusing your medicine? She said that she can't keep it down. Gave her the medicine through her veins so that she wouldn't have to feel sick, and she gave her anti-sickness. As a black woman, that's when I said I have to educate my people while they're pregnant, while they're going through labour, after they've had their baby. Then you know when to tell somebody that, listen, that's not how I want my care. That's not how I want you to speak to me. That's not what I want. Sometimes it's what saves their life.
This is a proven statistics, particularly in countries which are so racist, such as the United States of America. The people living in the USA are complaining that this country is very racist towards black people. You understand? We know how much the hospital should be taking care of its patients. The Hippocratic Oath, if you can remember, the Hippocratic Oath does not tell the doctors to prioritize a particular race of patients over others. The Hippocratic Oath cuts across all races, and it's something all doctors should adhere to. There's a story that I think it's worth analyzing and worth giving a critical analysis about the situation and the condition of black women giving birth to their children in the United States of America and in Europe or outside Africa. Black women are complaining that their children are being, that thing. They're also complaining that the way the white doctors are treating their black children or they themselves is not okay, is not humane. And the chances of a black child surviving in a white hospital or a hospital that has white staff is not good. The way white parents are treated as compared to black parents is not something which is justifiable. There's a story that a white nurse, is giving a confession about how these doctors are really treating black patients. I want us to watch this video, and then you'll come to the realization it is better now to give birth to a child outside the hospital, but not the hospital, particularly in countries such as the United States of America. Because of this, let's watch this video. I'll give my critical analysis by the end.
Now, this is going to sound racist, but These were the words of former GDC chair Rashpal Singh Monder just moments before he told a colleague that he wouldn't want to be treated by an African dentist. The GDC, for those who don't know, is the regulatory body within the UK that every practicing dentist must register with and pay their £680 annual fee. And I know what you're thinking, this post is supposed to be about the NHS, but every practicing NHS dentist in the UK must register with the GDC or they are not allowed to practice in the UK. So it's not really like we have much choice. This story went fairly under the radar in the dental community, so I'm bringing it to light again and showing the good people of TikTok that people with these racist ideologies somehow manage to make their way into positions of power. Let's not forget that minority ethnic doctors in the UK are 50% more likely than their white counterparts to be referred for sanctions or warnings from the GMC. Mr. Mondale was suspended for 6 months and removed from his post at the GDC.
A few weeks ago, one of the nurses presented me as head of the department or chief of the department, and the patient looks at the nurse and starts shaking their head and saying, this can't be, he must be chief of some African tribe. And it was just, yeah, and this is, I'm in a situation where I'm there for the patient. I'm there to try and get them through this tough time, and to be treated like that. And, I've been in a room when they've asked for the real doctor. I've been called the N-word by patients. It's hard to talk about, but it's an important issue that unfortunately it's still present despite it being 2023.
Okay, so I wanted to touch on this topic a bit, okay? I had my first kid when I was 31. And when I had her, I had a tear, it was a minor tear, but I had a tear. So my doctor, which was a Asian woman back then, she was young. I think we were the same age. She had taken care of me the whole pregnancy and whatnot. So obviously this is my first kid, it's not a problem. So we, so I have the baby and I have a tear, and then she goes to proceed to stitch me up. And I tell her, I can feel you. She was like, oh, the numbing liquid is it's gonna numb you. You're not supposed to feel it. And I was like, okay, but I can feel it, right? And then she starts stitching me and I can actually feel it. And my husband had to leave our newborn daughter to come cater to me and kind of like, hey, she can feel it. And then that's when my doctor was like, oh, crap, you can feel it. So she stopped and basically let the numbing agent work. That was that. Let it go. I had my son, 2019. Naturally, after you have your kid, it takes a while for the bleeding to stop, about 6 weeks. I bled for 12 weeks. I called her after 6-7 weeks. Hey, I'm still bleeding. Oh, we can't do nothing until past 12 weeks. I'm like, okay, 12 weeks comes around. Hey, I'm still bleeding. Oh, wow, you're still bleeding? That's weird. Let's go ahead and get you checked out. What did they find in my uterus? Placenta. Placenta was still stuck in my uterus 3.5 months after I had my son. All the horror stories of what could have happened. Sepsis, I could have, it was crazy. So when I hear stories about, Black women not feeling pain and whatnot, it's sad, because at this day and age, where are we protected? Where are we protected? We're not protected in the streets. We're not protected in school. We're not protected in the basics of giving childbirth is scary. So now I had to leave her, because fool me once, shame on you. But fool me twice, shame on me. There will not be a third time, So I just had to touch on that real quick and say that Black women, we need to be heard. You understand?
In 2011, I was married to somebody in the military, and we were stationed at Aviano Air Base in Pordenone, Italy. And I had given birth to my second child on the economy, which means I gave birth at Pordenone Hospital. I had a roommate in the labor and delivery room who was active duty as well. And I want to tell you about my experience with her, because as an African American woman, she was not treated the same at all. And I watched that firsthand in this experience. Her pain levels, anytime that she said she had pain, they didn't believe her. Anytime that she said she needed help, they didn't believe her. And about 36 hours into my delivery, right after my delivery, or into my stay, however you want to say it, she made the choice to no longer continue in life. And it was very traumatic for all of us involved. There hasn't been a day that I have not ran through that situation in my mind, because mind you, like, I called the command post, I called the first sergeant, I called the base labor and delivery, I called the new parent support program, and I said, you need to get up here and you need to help this woman. And nobody came in time. In fact, the first sergeant sent, yes, her friends, but somebody with no authority to really actually help this situation. And it was very difficult to watch unfold because once it unfolded the way it did, they made me go see a counselor because they wanted to make sure that I wasn't going to make that choice to no longer continue in life. And let me tell you, I looked them dead in the eyes and I said, if they treated me the same way they treated her and they did the things that they did to her, I would have made that same decision to not continue in life. And of course that like set off some red alarms and red flags, and like they started freaking out, but it's the truth. She was not treated the same. She was not. And unfortunately, we all had to walk the aftermath of that, right? Because it impacts a whole community. And it was so freaking difficult to go through. But I can tell you firsthand, I saw that she was not being treated the same. I saw that they were questioning her. I saw that they weren't listening. And listening is a very important piece to labor and delivery and postpartum care. And yeah, it was one difficult season, but I'm telling you, if you hear somebody say they weren't treated the same and they are African American and it is pregnancy, postpartum, during pregnancy, whatever, believe them. It's true. They have no reason to lie. And I've seen it firsthand. And let me tell you, it is the most difficult thing to watch because you know that they aren't being treated the same.
To one of the many reasons why I have zero interest in motherhood. This society is not set up well for motherhood. It doesn't take motherhood seriously, which is baffling because nobody would exist without mothers. From everything from maternity leave to before and after childcare, and everything is far worse when it comes to Black women. I get some people just want to be mothers and some people want to have children, but I really don't understand why every time somebody announced their pregnancy, I'm like, okay. But you know, I'm not going to project my own feelings and my own choices onto other people, but I have absolutely no interest in burdening any child or any soul with the problems of this fucking world. Which is why I laugh when people try to convince child-free people to have children, especially when they're Black women. Absolutely not. When one of my friends was giving birth to her son years ago, the doctors literally sliced her open because they wouldn't listen to her when she kept saying she wasn't under like the anesthesia or whatever, the numbing medicine they use for C-section. She kept saying, I still feel that. I still feel that. It's like, oh, it's going to kick in at any minute, and proceeded to slice her open. And of course, she screamed so loud, they had to immediately put her out, like put gas over her mouth or whatever to knock her out because they fucked up. And I tried to get her for so long to sue the fuck out of them. And she never did. But, you know, these things happen all the time. If they'll happen to Serena, if they'll happen to Beyonce, you think they won't happen to our regular asses? And everybody like to think it's not going to be them. Everybody like to think that they're the exception. But how many times have you gone to the regular doctor and complained about something and they brushed it off? They do it all the time. They do it with everybody. But of course, with everything else, it's way worse for us.
Now, after watching this shocking revelation, what comes into your mind as a Black person, or rather as an African, who wants to move to the United States of America, I can advise you, if you insist on going to the United States of America as a black person or as an African, yes, Africans are so eager to go there. Please, if you are pregnant, give birth in Africa first. Give birth in Africa before you go to the United States of America. I think your child is more important than those your desires of traveling to the United States of America. You've seen how this white nurse has said, because the chances of your child surviving are very minimal by the way you will be treated. You know how much the black person is treated all over the world. Your child is no exception. If you are African, your child will be African. I don't think it's worth it to risk the life of your child over your desires of going to the United States of America. If you cannot suppress them, then don't go. And right now, this is 2024. It is the year of revelation. We are seeing many things coming out. This is the same year that we've seen the president of Iran pass away. This is the same year that we've seen Putin revealing the black deities, the black gods, the black heavenly beings. This is the year that so much is to happen. This year is the year of revelation. And if doctors themselves have come forth and confessed that this is happening, then it's really happening at a large scale. The type of racism in the United States and in Europe, which is happening to black people, is systemic. It's rooted in the government itself. It's in the fabric. It's the fabric itself of the modern United States or the Western societies. You understand? These people are still being affected by the ghosts or by the phenomenon of white supremacy, of white privilege. It's still affecting them. And I'm thinking, Africans should really not go and stay in the United States of America. If you want to go and work, very, very understandable. If you want to go and study, very, very understandable. Because it's no way you trade your freedom for luxury. Even you will not get enough time to enjoy your luxury. Your life might be cut short by the events happening over there. The chances of a United States police pulling over a black person are very high. The chances of shooting a black person are very high. You'll be shot and they'll pretend like you did the wrong thing, and they will edit the the body cam footages. You'll just be another news just like any other person. This is why I highly insist, you don't need to go to the United States of America. Stay in the United States of Africa. Stay here, please. Please, 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 for the sake of your child, particularly if you are pregnant, don't go to USA. Mama, don't go to USA. Stay in Africa. Don't go there. Don't risk the life of your child and yourself. Stay in the motherland. God put us here, and we should thrive here. It's good that the white nurse has gained some consciousness. She has gained some humanity to speak the truth, because the truth takes a toll on yourself. Understand? Not everyone has the capabilities of speaking the truth, and if one does, we should appreciate and we should act with caution. Somebody once said, Oprah Winfrey once said, I was once watching her show, and she said, if somebody shows you who they are for the first time, believe them. Believe them. Don't give them the benefit of doubt, but believe them. Just believe them. That is the nature of people in the United States of America. You've seen it many times. You don't need to go there. If it's work, there's something you can always do here and work. That is my advice. I know it will meet a lot of objections. I know. Remember, before you comment anything on the comment section, keep in mind of those black children. Just consider those black children before you comment any negative thing on the comment section. That's my thought for today. I'm here in Africa. I'm enjoying Africa. You understand? So see you in the next video where we will also have a deep critical analysis. I hope you, if you are an African woman and you're pregnant and you're planning to go to US, give birth first. If you can't hold your desires, at least give birth first in Africa, then you go.